This video is for shoulder replacement surgeries at Doylestown Hospital. Thank you for choosing Doylestown Hospital's Orthopedic Institute for your upcoming surgery. We are extremely appreciative of the fact that you have selected us for your upcoming shoulder replacement surgery. This presentation is for total shoulder replacement patients that are staying overnight at Doylestown Hospital. Please refer to your teaching packet throughout this presentation. We are committed to helping you through this journey. No question is too small, and although we have tried to capture the most common questions, we know you may still have some. If you have a question after this presentation, feel free to contact our orthopedic navigator at 267-893-9303. If you have not read your total shoulder booklet, please stop the video and read the booklet first. At Doylestown Health, we are committed to your care. The Orthopedic Institute participates in the American Association of Orthopedic Surgeons Shoulder and Elbow Registry. We consistently receive high scores on our patient satisfaction surveys. The goal of this video is to help alleviate your anxiety, to help you understand the preoperative, postoperative, and surgical process, and to help prepare you for your upcoming surgery. We want to identify and clarify things that you need to do before the surgery, to help you identify some equipment that you may need prior to the surgery, and to help you really understand the whole process from start to finish. Your surgeon's office provided you with a pre-admission folder. Please make sure that you have the folder available to you throughout this presentation. This folder includes important information regarding your surgery. It includes directions to your preoperative testing areas. It also has a questionnaire and a medication list that must be completed prior to coming to the pre-admission visit. You also will have a date with directions on the pre-admission physician-assisted visit, which I will talk about in the upcoming slides. I'm going to begin to talk about our preoperative process. If you have not received a phone call from our orthopedic navigator, she will be calling you soon. She will identify her role. She will discuss tentative discharge plans with you. She will also tell you about the goals of the program. She will answer any questions you may have. You may find her business card in the folder if you would like to speak to her prior to this call. You will also receive a call from the hospital in regards to your pre-admission testing. This usually occurs about 3 to 4 weeks prior to your surgery. We ask that you complete the pre-admission health questionnaire and your medication list that you can find in your folder prior to coming for your testing. Please also bring with you your medication bottles. This way, the nurse can confirm your list. During your pre-admission testing, you will have blood work. You will also receive an EKG if you are not going to see a cardiologist. Not everyone needs to see a cardiologist. Your surgeon will tell you if you need to see a cardiologist. If there are any issues with any of your tests, the physician's assistant will contact you directly and will discuss test results with you. Not only will you receive blood work at the visit, you will also meet with one of our pre-admission nurses. She will review with you your completed questionnaires, your medications, and your pre-op instructions. In your packet, you will find the pre-admission checklist. Please use this checklist over the next several weeks. Your pre-admission checklist was developed to help you plan for your upcoming surgery. The nurses in this presentation will go over all the items on the list. If you still need clarification, please contact the orthopedic navigator. Again, I ask that you please complete the pre-admission health questionnaire and your medication list prior to coming to your pre-admission visit. Once your pre-admission testing date is scheduled, we ask that you call and make the following appointments: your family doctor and your dentist. Not everyone needs to see a cardiologist. However, if you do, please make that appointment. If you are identified by the surgeon as being at high risk for anesthesia, you will be called by an anesthesiologist. If you have any concerns about anesthesia, please let the navigator know, and she will help coordinate a phone call and or an appointment with the anesthesiologist prior to your surgery. We ask that you complete these visits prior to your physician assistant visit. It is important that you schedule these appointments after you have your pre-admission testing, as your physicians will use the blood work that was just performed at the pre-admission testing during your visit to ensure that you are medically cleared. From the time of pre-admission testing, the physician assistant will follow your medical course of care prior to your surgery. She will review all the pre-admission testing information. She will also coordinate to make sure that the medical and dental clearances are completed and that you will be cleared to have your surgery. If there are any issues or concerns, she will contact you directly. She will review your medical history and she will perform a physical at the visit. She also reviews all your medications. She will talk to you about the post-operative plan of care. She will also be available in the hospital to assist with your post-operative care. We ask that you start preparing for your surgery. We ask that you please have someone available to go home with you after your surgery for a few days. We will be talking about equipment, and you need to purchase the necessary equipment and supplies that you may need at home. You should pack clothes and toiletries for the hospital. If you're told to stop certain medications prior to your surgery, please follow the instructions that were provided. As stated previously, based on your past medical history, you may be instructed to meet with an anesthesiologist prior to surgery. This option is also available to any patient if you have any concerns. If you have specific questions, let the orthopedic navigator know, and she will assist you in setting up an individual appointment with an anesthesiologist. I will now talk about some items you will need after your surgery. The first one is a brace. This brace will be provided to you during your operation. You do not need to worry about getting this beforehand. You will be provided with the brace, which will be worn at all times, with the exception of performing your exercises and showering after your surgery. Your surgeon will tell you how long you must wear this brace. Because your arm will be in the sling, you may need to think about what's going on in your bathroom. Depending on the height of your toilet, you may need to purchase toilet equipment before your surgery. We recommend either a 3-in-1 commode or a raised toilet seat. Insurances usually do not cover these items. Depending on your shower or tub setup, you may think about the following items. Will you need a tub seat? This can be purchased with or without a back. Do you have grab bars? Do you have a handheld shower head that could help you during your recovery? Again, insurances usually do not pay for these types of devices. You may want to think about purchasing temporary suction grab bars. You should make sure that they work properly prior to your surgery. They do not always stick on all surfaces. All of this equipment should be purchased prior to your surgery. The week before your surgery, we're also going to have you do several things. The first is showering with special soap. The Hibiclin should be used for your shower 3 nights prior to your surgery and also the morning of surgery. You are to place clean sheets on the bed, wear clean clothes to bed, have no pets in your bed. There is a sheet in your packet describing how to shower. We also ask 3 days prior to your surgery that you begin to use the mupirocin ointment. You are to get a prescription from the physician assistant at that visit. You are to place the mupirocin in your nose 3 days prior to surgery, in the morning and in the evening. Please do it prior to coming to the hospital. We will do it at the hospital the night of surgery, the next morning, and then we'll ask for you to do it the evening that you are discharged. You do not need to bring your mupirocin ointment to the hospital. If for some reason you do not have your mupirocin ointment, please call your surgeon's office to get a prescription for it. We also ask that you call the surgeon's office between the hours of 3 and 4:30 to find out what time you need to arrive at the hospital. If your surgery is on Monday, please call on Friday. You also are unable to eat anything after midnight. Although you are not allowed to eat anything after midnight, you can drink clear liquids up to 2 hours prior to your scheduled arrival time here at the hospital. A clear liquid is anything that you can see through. This includes black coffee and tea, but you cannot have cream in the coffee or tea. If you do not adhere to these guidelines, we may have to cancel your surgery. Your day of surgery has finally arrived. There are a few things that we ask you to do this day. Again, you are only allowed to have clear liquids up to 2 hours prior to your surgery time. You are not allowed to have food after midnight. We want you to shower using your Hibiclins in the morning. We also want you to use your mupirocin in your nose prior to coming to the hospital. You will report to the same-day surgery area on the 2nd floor of the main building. Check in at the volunteer desk, and they will take you back to the same-day surgery area to begin to prep you for your surgery. Only one person is allowed to come back to you to the same-day surgery area. Additional guests can remain in the atrium. You will be escorted to the same-day surgery area by a volunteer when it is time for you to come back to the suite. Once you're back in the same-day surgery area, the nursing staff will begin to prep you for your surgery. You will receive an IV. You will begin to receive fluids, pain medication, and antibiotics through the IV. You will have this IV in place throughout your stay here at the hospital. If it does not have fluids running through it, it will be capped. Your arm will be cleansed with wipes. Your hair will be clipped if necessary. Your arm will be initialed to ensure that surgery is being completed on the correct arm. You will use the restroom prior to surgery. Your anesthesiologist will come meet with you. They will talk about anesthesia options. The nurse will do an assessment and review all your medications. We ask that you bring your current list of medications. If you are instructed to bring any medicines to the hospital, please do so. You do not need to bring your mupirocin ointment. Once you are done being prepped, it will be time for you to go back to the operating room. If you are not the first case of the morning, you will go to our holding areas. If you are the first case, you'll go directly to the operating room. Prior to your surgery, we will be giving you a dose of antibiotics. We also give you 2 additional doses throughout your stay. During your surgery, your vital signs will be monitored. This includes blood pressure, heart rate, and oxygen levels. We do not permit family members in the operating room with you. Your surgery will take approximately 1 to 2 hours. Your physician works with the vendor prior to your surgery to make sure that your implant is the appropriate fit and size. The hospital team then prepares the new joint prior to the surgery so it will be ready for you. The physician makes an incision. The length will vary based on your body type. The length will be as long as needed to make sure that he has good access to the joint. You may be thinking, what happens during the surgery? Basically, what happens is the damaged or degenerative parts are removed and replaced with new artificial parts. In order to understand what is replaced, we will review what a normal shoulder looks like. This is what a normal shoulder looks like. In a traditional shoulder replacement, the ball of the upper arm, or the humerus, and the socket, the glenoid, are replaced. In a reverse total shoulder, a metal ball is attached to the socket side, which is the glenoid, and a plastic socket is attached to the upper arm bone, where the ball, the humeral head, used to be. During the surgery, the parts are tested by moving your shoulder in multiple directions to ensure a proper fit. X-rays are taken to ensure that it is in the proper position and in alignment with your other arm. The incision is stitched with dissolvable stitches on the inside, and your incision will be closed with glue. We will also put a protective covering over your incision. This covering will stay on between 5 and 7 days. You will receive instructions on how to take off the covering. During the OR, foot pumps will be placed on your feet. This is to help prevent blood clots. You will be transferred from the OR table to your hospital bed and then taken to our post-anesthesia care unit, or our PACU. You will stay there to recover. You will have your sling in place when you wake up from anesthesia. This sling will stay on at all times with the exception of showering and performing your exercises. In the PACU, your pain will be assessed and medications will be provided through your IV. You may receive a scalene canal block during your surgery. This will be described and reviewed with you by your anesthesiologist. In the PACU, they will make sure that you are comfortable and that you safely are coming out of anesthesia. Your time in the PACU will depend on how you're recovering and if your room is ready for you. Family members are not permitted in this area. The surgeon will come out to talk to your family members after the surgery. Here at the hospital, we use a multimodal pain management program. The plan starts prior to the surgery and continues during your stay. You will be given medications prior to your surgery, and you will be given medications based on your level of pain after the surgery. You will need to ask for your pain medications. The nurses will ask you, but if you are in significant pain or your pain is not tolerable, you need to talk to the nurses. Your medications will be explained to you by the nursing staff. If you have any questions, please ask. We use a pain scale of 0 to 10 to rate your pain. Please see the purple sheet in your folder. You will be asked your pain level several times throughout the day. Pain medications work in different ways, and people respond differently to pain medications. If your pain is not tolerable in the hospital, you will need to let the nurses know. If your pain is not tolerable at home, please call your surgeon's office. You are having an orthopedic surgical procedure, and you will experience pain post-operatively. Our goal is for your pain to be managed appropriately to allow you to be as comfortable as possible and still be able to participate in therapy. Please note that pain medications do cause constipation. You will be prescribed a stool softener while at the hospital. You should continue with this medication at home. If you go longer than 3 days without having a bowel movement, you will need to let your surgeon know. Upon discharge, you will be given prescriptions for pain medicine. ShopRite Pharmacy is located on the first floor of the hospital, and you can fill your prescriptions there, or someone can take them to your pharmacy to be filled. When you go home, it is important to take your medications as prescribed. If you have questions, please call your surgeon's office. Even though the physician assistant's name may be on your prescription bottle, you need to call the surgeon's office. The salmon-colored sheet reviews the common medications that are given on the orthopedic unit. You can find this in your folder. This form will be completed for you when you are here at the hospital. It lists several side effects for pain medications. If you are experiencing any of these, you should let the surgeon know. To help prevent blood clots following your surgery, most patients will be instructed to take 325 milligrams of aspirin once a day for 4 weeks. If you are already on Coumadin, your blood work will be monitored post-operatively. Unless notified otherwise, your surgeon will be responsible for monitoring your Coumadin levels when you go home. If you are on a special medication such as Pradaxa or Eliquis, you will be placed on Coumadin post-operatively and then will return to your pre-operative medicine when instructed to do so. You will be provided with specific instructions at discharge about how to manage your blood thinners. Now that I've talked about pain medications, I'd like to go back to the day of surgery. After the PACU, you'll be taken to the floor and you will go into your room. You will be greeted on the floor by the nurse who will do an assessment. The nursing staff will take your vitals, meaning blood pressure and temperature, frequently throughout the day. They will also monitor your pain levels. They will be able to give you pain medications. They will also give you 2 doses of antibiotics during your stay here at the hospital. They are there to help you. Please do not get up without the nurses. If you need anything, please ring your call bell and someone will come in to help you. You will begin to take pain medications by mouth as soon as possible. Here at the hospital, we provide our meals by At Your Request program. These meals are made to order and are delivered within an hour of ordering. The staff will assist you in placing your orders. Once you are taking food, we will begin to transition you to oral medication. Because you had surgery, you will not be permitted to get up by yourself. We ask that you please ring your call bell for help. Occupational therapy will begin the day of surgery. As stated previously, you will have foot pumps on your feet while in bed in order to prevent blood clots. Ice packs are available to help with your shoulder pain and can be placed intermittently throughout the day. Depending on your past medical history, you may have other physicians come to see you while in the hospital. These may include a hospitalist or a cardiologist. You will see occupational therapy, or OT, during your stay here at the hospital. They will go over your home exercise program with you. They will also teach you how to get dressed and use your arm in the sling. They will also review with you what we call activities of daily living: bathing, toilet hygiene, meal preparation. As stated previously, you will be in your sling for several weeks. You are only allowed to come out of the sling for bathing and for your exercises. There are also certain motions that you may or may not be able to do. They will review these with you following surgery. If you remember, I did say that we would start discharge planning prior to your surgery when you talk to the orthopedic navigator. At times, the plan that you had in place may change depending on how you are doing. The navigator will assist you with your discharge planning needs. She will help arrange any needs you may have when you leave the hospital. The goal is for our patients to go home directly from the hospital. If you are unable to go directly home, the navigator will discuss your options with you. Everyone has different insurance plans, and this can impact where you go. Research shows that the best way to recover is in your own home. However, this is not always possible, and each patient is assessed to ensure that the home is the safest option. The navigator will discuss discharge plans with you. You will be given instructions upon discharge for when your special dressing is to be removed. You should use good hand hygiene at all times in order to prevent complications. You should call your surgeon if your wound is draining, has redness, or you have a fever. When you are ready to be discharged, it may be recommended that you go home with home care. You will have a nurse and an occupational therapist come to your home. You will receive these services for 2 to 4 weeks depending upon your surgery. It is important to note that these services do not occur every day. Your surgeon will discuss with you at the time of your follow-up appointment when you should start physical therapy. You usually have your follow-up appointment set up by the surgeon's office prior to the surgery. Unless your insurance dictates that you use a specific provider for physical therapy, you have the ability to choose where you would like to go and what home care provider you would like to use. The navigator will discuss the options you have available to you. The Orthopedic Institute recommends that you use Doylestown Health's home health care and Doylestown Health outpatient therapy for your therapy needs. Our staff has extensive training on your surgeon's protocols. They work closely with the surgeons to ensure that you are on the path to a speedy recovery. Outpatient therapy is usually 2 to 3 times a week. The usual length of stay for patients with shoulder replacement is 1 day. You usually do go home the next day. When you go home, you will receive a survey following your surgery. Please complete the survey as we value your input. If you have any concerns or you have feedback and you would like to speak to someone, please call Cheryl Talamo at 215-345-2065, or you can email her at ctalamo@dh.org. We do have some frequently asked questions that we often hear. One is, how long will I wait before I go into surgery? You usually need to wait about an hour and a half before you go into the surgery. However, it may take up to 4 hours from the time that you arrive at the hospital to the time you get to your room on the orthopedic floor. Another question is, how will my family get updates on how my surgery is going? Your family is welcome to wait in the family waiting area, and they will be provided updates about how you are doing. Your surgeon will talk to them after the surgery is complete. How long should I wear the sling? The surgeon will tell you how long to wear the sling. It will be anywhere from 2 weeks to 6 weeks, usually. What should you bring to the hospital? You should bring comfortable, loose-fitting clothes. You will be wearing a sling, and therefore you may want a larger size top. Please bring supportive shoes. Shoes without ties or elastic laces are usually easier since your one arm will be in a sling. You should bring an updated list of all your prescriptions with you and any over-the-counter medicines. If you're planning to use your cell phone, do not forget your charger. Any personal items such as cosmetics or toiletries you may bring. Please do not bring any valuables, as we are not responsible for the loss of valuables here at the hospital. This concludes the video. Thank you for watching this presentation. Please click the button at the bottom of this page to verify that you received this education. If you have any questions, please call the orthopedic navigator and she'll be happy to help you. We look forward to meeting you, and we will see you soon.